Let's now go to identification of patterns. Let's discuss concept of disease in Chinese medicine. The concept of disease in different is different in Chinese medicine than in Western medicine. In Chinese medicine, a disease is actually a symptom in Western medicine. For example, in gynecology, painful periods is a disease category, whereas in Western medicine, it is a symptom. And Western medicine would attempt to find a disease such as endometriosis causing the symptom of painful periods. Other examples of diseases in Chinese medicine are diarrhea, constipation, cough, breathlessness, dizziness, headaches, epigastric pain, abdominal pain, and others. As can be seen, these are all symptoms rather than diseases in Western medicine. Here we can see the relationship between Chinese disease and patterns. However, there is no reason why it should not be possible to apply Chinese style pattern differentiation to Western medical diseases, and indeed many modern Chinese medicine books do just that. For example, the Western medical disease of coronary heart disease broadly corresponds to chest painful obstruction syndrome, or chest P, in Chinese medicine. If we were to examine and perform a Chinese medical diagnosis on a large enough number of patients suffering from coronary heart disease, we would be able to identify the most common patterns displayed by those patients. Given the hospital structures existing for Chinese medicine in China and the large number of patients using them, modern Chinese doctors are in a position to apply Chinese pattern differentiation to Western medical diseases. Another example that springs to mind is that of endometriosis. As the chief symptom of endometriosis is painful periods, we can treat this disease by referring to the Chinese disease painful periods. However, if we analyze the patterns displayed by a large number of women with endometriosis, it is equally possible to make a Chinese pattern differentiation of endometriosis. Indeed, in some cases, a pattern differentiation according to a Western rather than Chinese medical disease can enhance our treatment. Endometriosis is a good case in point. There's a general consensus in modern China that the migration of the endometrial tissue outside the uterus must be seen as a case of blood stasis. If we rely purely on Chinese diagnosis and pattern identification, in many women with endometriosis, we may not see signs of blood stasis. The tongue is not purple, the periods are not very painful, there are no abdominal masses, and therefore not apply the important treatment method for invigorating blood. Of course, there is some correspondence between Chinese and Western diseases. For example, the Chinese disease epigastric pain obviously may correspond to Western digestive diseases, such as gastric ulcer, which presents with epigastric pain. However, there is never a direct one-to-one correspondence between a Chinese and Western disease. In the above example, very many people will suffer from epigastric pain without having a gastric ulcer. Finally, in a few cases, there is a direct correspondence between Chinese and Western diseases, with the two entities coinciding entirely. Examples of such identification between Chinese and Western diseases are epilepsy, malaria, dysentery, and measles. To summarize, a disease in Chinese medicine, like painful periods, is actually a symptom in Western medicine. The discussion of diseases may be found already in the Yellow Emperor's Classic of Internal Medicine. Thank you for your attention.